Okay, now we're good.
Yay, I see it.
Okay, we are good. We are live, and I'll go ahead and make George make you the host, and then just
Okay. Start recording.
Co-host, and we're good.
If you want to revert to making Betsy co-host just in the event.
Yep. Yep. Anyone else? No.
We're good as gold at this point.
Right.
Oh, I'm going to go dark and quiet, but I'll be here.
Okay. Thanks, David.
Yep.
Okay, we're good. Yep.
Hey, George, do you anticipate this going the full time till 12?
Probably not, but we do have a lot to cover.
I mean, I'm available all the way through, and I have booked myself. I was just checking on your field for time.
Okay. Betsy.
Caroline, would you mind just doing another quick test of the captioning to make sure it comes across on YouTube? Let's see. Okay, there it goes. Thank you. So George, you got 5 people in the waiting room.
Yeah, I'm just letting them in.
Hey, George, can you hear me?
I can hear you, Rick.
Good.
How are you?
I'm well, and you?
So just a reminder to everybody who's just joined us, we are live streaming this to YouTube, and I'll be recording it once we get started as well.
Good morning.
Good morning, Travonia. How are you?
I'm good.
Good morning.
Good morning.
Morning.
Forgot my glasses.
Hey, George.
Yes.
Hey, George. Hey, this is Karen Garner. I just wanted to let you know that I have another call at 11 o'clock for work that I need to do. So I will have to leave this meeting at 11.
Okay. All right. Thanks for letting me know, Karen.
You're welcome. Hi, everybody.
Hey.
Hey, Karen.
Hi. And Marcia, I have a change of address. I just moved this past week. So is it you that I send it to?
If it probably send it to George.
Send it to George?
Yeah, send it to me, please.
Okay, I will do that. Thank you.
Thank you.
Uh-huh.
And congratulations on your move.
Thank you.
Okay, folks, it's just after 10, so might as well go ahead and get started. Laura, would you like me to just go ahead and do all the housekeeping first?
Yeah, why don't you just run through it?
George, don't forget to record.
Yes, thank you. Recording now. So, good morning. Welcome to the Alzheimer's Disease and Related Disorders Commission's quarterly meeting. Today, Tuesday, September 8th, 2020, 10 a.m. to 12 p.m. We do have a lot on the agenda today, so in order to get through it all, we're going to need to be very diligent and conscious of our time. I've got a number of housekeeping instructions first. So due to the active state of emergency, this is an electronic meeting pursuant to item 4-0.01 of the 2020 Appropriation Act. Meeting notice has been provided. The meeting is being recorded and minutes are being taken. All votes will be conducted by a roll call of voting members. Meeting materials are posted under the Alzheimer's Disease and Related Disorders Commission's quarterly meeting tab at the link posted in this slide. Actually, it's on our DARS Boards and Commissions web page. Members of the public are able to live stream this meeting via the DARS YouTube page. Please be advised that if the live stream is interrupted, we will need to pause the meeting until it is restored, and we do have folks that are keeping an eye on that. Public comment will be accepted by email or phone to my attention. Public comments that were received by September 7th will be read or, if lengthy, summarized during the meeting when we reach that agenda item. For the Zoom functions, most of you are probably familiar with Zoom by now, but for members, please keep your microphone on mute unless you are speaking. That helps to reduce the background noise. Also, before you speak, please state your name. Not only does this help your colleagues on the commission know who is speaking, but it also helps Cecily with documenting the minutes. And this is particularly important as our committee members will be discussing recommendations, and our captioner will be trying to caption the discussion. Members and guests, if you have your video enabled, please be aware the system may capture your image and video in the public streaming and recording. Please only use the chat feature if you have a technical issue or other issue not related to the business of the meeting. Chat comments are not captured in the live stream or so are not available to members of the public. You can also use reactions to do a thumbs up for agreement or clap to raise your hand to speak, although this feature may not be used in place of a verbal vote in a roll call. If you'd like to view the real-time captioning of today's meeting, please click on the CC button on the menu bar at the bottom and select Show Subtitles. Zoom participants will be able to turn on closed captioning. The YouTube streaming will automatically include the captioning. View options in the area on the right-hand side of your screen, you can set yourself. Some features will be set by the host. And for all votes, we will do a roll call, and you'll be asked to indicate support, A or yes, opposition, nay or no, or abstain. Lastly, I'd like to thank the DARS video teleconferencing team and the DARS communication team for making this electronic meeting possible. I'll do a roll call of members first to confirm attendance. So please answer present. Laura Bowser.
Present.
Trevania Brown Hughes.
Present.
Karen Garner.
Present.
Chris Desimone.
Present.
Karen Garner.
Present.
Rick Jackson.
Present.
Kurum Khan.
Present.
Kim Kuttner.
Present.
Carol Manning. Lori Filippo and Lana Sargent both sent regrets. They're unable to make it. Margie Shaver.
Present.
Crystal Thompson.
Present.
Pam Teaster.
Present.
Ishaan Williams.
Present.
Thank you. So we do have a quorum, and I'll turn it back to you, Laura.
Great. Well, welcome everyone. I guess this is our first quarter meeting. I'm not sure how it's September, but I hope you had a great long weekend. I thought as I sort of promised last time that we would start by introducing our 5 new members and then actually going around and introducing ourselves, just so it's a little bit awkward online, but we can try and just get to know each other a little bit. And so we have 5 new members. That includes Trevania Brown Hughes, Kim Kuttner, Margie Shaver, Crystal Thompson, and Ishaan Williams. And so I was just going to roll call our new members, and then we can kind of popcorn. Maybe George, you can call on us in order, just to sort of say who we are, kind of our role and background, and where we're located as well. So with that, Trevania Brown Hughes, do you want to give an introduction of yourself? And welcome.
Oh, you're muted. Trevania, you're muted.
Sorry. Hi, hello everyone. Ishaan, thank you so much for that welcome. It's truly an honor to be a part of the commission. I am currently an assistant professor at Hampton University. I'm in the School of Pharmacy, although my background is in gerontology. So I graduated from the University of Kentucky. Dr. Pam Teaster is also on the commission, and at one time, a long time ago, it seems, she was my mentor. Also, too, I did some work with her while at the University of Kentucky. So it is truly an honor and a treat to be able to work with her again. So thank you all again for having me.
Thank you and welcome.
Thank you.
Kim Kuttner?
Thank you. It's an honor to be here with these great smiling faces, familiar faces. So the last 17 years, I've been working with Riverside Health System. And so it's great to see Rick here. I was raised in Richmond and now living in Williamsburg, Virginia with my husband and 4 kids. My Bachelor of Science in Health Services Administration and Gerontology is from JMU. And then I earned my Master's of Public Health at UCLA. Also, education-wise, certified senior advisor, TIPA SNO, positive approach to care, certified trainer, and master trainer for chronic disease self-management. So you see my focus has kind of been gerontology. And as a licensed nursing home administrator, I practiced as an administrator in California and also Virginia with Riverside. And so currently working with the Riverside Center for Excellence in Aging with translational research, really focusing on older adults and caregivers, education and support, as well as I'm also managing care coordination, community-based care coordination for Choose Home. And so the care coordination piece, it all just really fits. I'm really happy to help serve with you all.
Well, thank you and welcome.
Thank you.
Margie Shaver?
Sorry. Hey, I'm Margie Shaver. I am from Roanoke. I'm a retired marketing advertising guru. I've marketed everything from car dealers to senior facilities to a lot of stuff in between on television stations. Been involved with the Alzheimer's Association for about 20 years. My mother had Alzheimer's. My grandmother had Alzheimer's and 3 aunts had Alzheimer's. So it's quite a passion of mine. I've served on the board of the Central and Western Virginia chapter. I've been an advocate, I've been an ambassador, volunteer, and I'm just really honored to be a part of this commission.
Well, thank you and welcome. Crystal Thompson?
Hi, good morning. I'm Crystal Thompson. I'm from Roanoke, and currently I'm the State Director of Family Preservation Services, which is a behavioral health company. For many years prior to that, I was in the nonprofit world, working with acquired brain injury survivors, working in child welfare, working with refugees and the homeless population, basically just serving the most vulnerable persons within our community. I'm a Hokie, I have a couple of degrees from Virginia Tech. I come from a long line of Hokies and I'm very proud. I have my master's in counselor education. My reason for being here has nothing to do with what I do professionally, has nothing to do with my professional background. It has everything to do with my father, who was just diagnosed with Alzheimer's 2 years ago. My mother died when I was in my 20s, and that man has been everything to my daughters and I as a single mom. He has just been such a major support for me and my kids that I want to do everything I can to support him and many people like him. We're very fortunate to have a supportive family, but I am very much aware from my professional background that not everybody has those supports. And so this is my way of giving back to him in a way that, you know, in any way that I can. So thank you. I am very honored and privileged to be here.
Thank you and welcome. And last but not least, Ishaan Williams.
Hello, everyone. I'm Ishaan Williams. I'm an associate professor at the School of Nursing, but my degree, similar to Travonia, is I have a PhD in Human Development and Family Studies with a concentration in family gerontology. My research centers around older adults and family caregivers, and so looking at those who have dementia and how they have impacts by their physical and emotional health. And so I've done a lot of work in healthcare and with my nursing colleagues, as well as with Carol Manning and Pam Teaster on the call. So I have some friendly faces here that I know, and I'm looking forward to working with everyone.
Well, thank you so much and welcome. And thank you all. We're really excited to have you. And so I thought we would just go around and sort of briefly introduce ourselves. And George, I can start and then maybe you can just call on people. So I'm Laura Bowser. I'm chair of commission. I have been on the commission now, I think 6 years. My background is not, doesn't have anything to really do with this work either. I'm an HR consultant. But what brings me here is my mother passed away from early onset Alzheimer's. And when she became ill, I became involved on the commission, but also a volunteer with the Alzheimer's Association. And I'm still doing some volunteer work with them. I was on the board for a couple of years. And with that, it's just really nice to see you all, and hopefully we can meet in person soon.
Thanks, Laura. Okay, so I'll just go in order through the commission members and then guests and staff. Karen Garner. Karen, if you're speaking, you're muted.
I didn't. Okay, sorry. Thank you. Actually, you said Garner, or at least what I just read, Garner. So you wanted Darner or Garner?
Garner, you, please.
Okay. I need to tell the 5 new people that there is a Garner, a Darner. So you will often find that I get mixed up as well. I was a speech pathologist in the Arlington Public Schools for 35 years and retired just when I did the higher math of subtracting years, and realized that when my mother was not yet diagnosed, but we knew something was difficult for her, I retired and went to Arkansas where they had retired, worked with her, and then she passed away. And my younger brother was diagnosed about 2 years later. So, and he just passed away during the COVID pandemic. And I've been on the board for the last 1.5 years and almost 2 years, and have been active with the Alzheimer's Association's ambassador program, working with Congressman Don Beyer from the 8th Congressional District of Virginia.
Great. Thank you, Karen. Chris Desimone.
I'm Chris Desimone. I'm down in Roanoke. I'm an estate planning and elder law attorney. So our practice focuses on helping older adults, and my practice kind of catapulted into the fiduciary side the last 10 or 15 years. So I'm a court-appointed conservator and guardian, and focused primarily on helping people with dementia and dementia-related disorders. So that's kind of my side of this. For the new people, this board is fantastic. This is one of the best boards I've ever served on. I'm going to my 8th year, and this is really a solutions-based advocacy group, which is fantastic. And it doesn't just cover medical, but legal, regulatory. So I hope you enjoy your stay on the board. Thanks.
Thanks, Chris. Karen Garner with a G.
Hi, good morning, everybody. And I'd like to reiterate what Chris just said. It is a great board, and I'm honored to be part of it. I was in Newport News up until last week. I just moved, as I mentioned earlier, to Richmond. I'm just right outside of Richmond now. So still unpacking boxes and trying to find my computer charger. So I came to the commission because I was working with the Alzheimer's Association as an advocate and a volunteer in several different capacities. And I have been on the board now 4 years. I just re-upped for another tenure. I got involved with the Alzheimer's Association because my husband, Jim, had younger onset Alzheimer's, and he was diagnosed in his mid 40s and passed away when he was 53.
Thank you, Karen. Rick Jackson.
I'm Rick Jackson, and like all the rest of you, it's such an honor to be on the commission. I've recently finished a 4-year term and have been appointed for another 4-year term, so I'm really looking forward to that. Recently retired as the executive director of the Riverside Center for Excellence in Aging, where I oversaw all the wonderful work Kim and Christy do, and also oversaw Choose Home and managed something called Bay Rivers Telehealth Alliance. So for the past 25 years, all of my work has been in serving older adults. And so I'm very committed to that. And like many of you, I have a personal stake in it. My late mother died suffering from Lewy body dementia. So most of us, have both a professional commitment and unfortunately a personal experience. And so I share that with you.
Thank you, Rick. Kurum Khan.
Hi, good morning, everybody, and welcome to the new folks. I'm Kurum Khan. I'm based out of the Northern Virginia area, so just outside DC, near the Dallas airport. I have a dual standing out here because I work in an IT organization, but I also have a small home care organization that I own and serve the Northern Virginia population for the senior. Thank you.
Thanks, Kurum. Carol Manning.
Good morning, everybody. I'm Carol Manning. I don't know how many years I've been on the commission, but I enjoy all of them, and it's a great group, and I welcome the new people, several of whom I've worked with before, and I'm so happy to see that you're joining the commission. I am the director of the Memory Disorders Clinic at UVA, I thank you we had the emergency meeting, I guess, was it last week? And I really appreciate all your support. This is a wonderful commission, and I really appreciate being a part of it. And thank you especially George, who does a fantastic job. So
thanks Carol. Margie Shaver. Sorry. Pam Teaster, apologies.
Let me unmute. I'm pleased to be on the commission. I'm a professor in human development and the director of the Center for Gerontology at Virginia Tech. And I just finished my next to the last class, formal class, pursuing a second master's in bioethics. And so I'm feeling really good, but the next class starts tomorrow. So there you go. I've done a lot of work on elder mistreatment and a lot of research on guardianship. And of course, dementia has a component related to guardianship, and dementia has a component related to elder mistreatment. So I've done a lot of work in those areas. Unfortunately, I've known too many people, even my friends, who've been exploited, sometimes abused by individuals who have committed acts of unkindness to them. So I'm really pleased to be on the commission and lend the research that I can do and the advocacy that we can do. And it's really great, Trey. It's great to have you on here. I can't imagine, when I saw your face, it's just fabulous. And Ishaan, it's good to see you again too. So I take good care of my son up there because he was in clinical by 7 this morning. So I'm very glad to be with you all. And I am in Blacksburg.
Thank you, Pam. And guest Carter Harrison.
Thank you. I'm Carter Harrison. I'm the Director of Policy for the Alzheimer's Association. I've been in this role for 18 years, and I serve as a technical advisor and also a member of the legislative committee.
Great. Thank you, Carter. And staff, Marcia Dubois.
I'm Marcia Dubois. I'm the Deputy Commissioner for the Division for Community Living here at DARS. And like many of you, certainly been personally impacted by Alzheimer's disease. Had my father and my aunt both were caregivers for both of them, and they both passed away in 2013 and 2016. Respectively. So this commission specifically is one that I've really enjoyed being able to sit in on and listen to the important work that you do.
Thank you, Marcia. Kathy Miller.
Good morning, everyone. I'm Kathy Miller. I'm the Director of Aging Programs and Services here at DARS, and I also have a personal connection to Alzheimer's. We lost my father-in-law and my grandmother, both with dementia.
Thank you, Kathy. And I'm George Worthington. I'm the Dementia Services Coordinator here at the Department for Aging and Rehabilitative Services, and I am staff to the Alzheimer's Disease and Related Disorders Commission. And Cecily, are you able to unmute yourself?
Can you hear me?
Yes.
Okay, yes, Cecily Slazer, and I am admin support to the Alzheimer's Commission and the other two aging boards.
Great, thank you.
Thank you. So I will try and go through some of the administrative tasks pretty quickly so that we can get into the meat of the session. But we always start by reviewing our role and what the commission is here to do. So I'm going to read the code real quick. So as defined by Virginia Code, the role of the Alzheimer's Disease and Related Disorders Commission is to 1, examine the needs of persons living with Alzheimer's disease and related disorders, as well as the needs of their caregivers and ways that state government can most effectively and efficiently assist in meeting those needs. 2, to develop and promote strategies to encourage brain health and reduce cognitive decline. 3, advise the Governor and General Assembly on policy, funding, regulatory, and other issues related to persons suffering from Alzheimer's disease and related disorders and their caregivers. 4, develop the Commonwealth's plan for meeting the needs of patients with Alzheimer's disease and related disorders and their caregivers and advocate for such plan. And 5, establish priorities for programs along with state agencies related to Alzheimer's disease and related disorders and criteria to evaluate these programs. So thank you and welcome again. So with that, I'm going to move directly into reviewing and adopting this meeting's agenda. So all of you should have received the agenda that George sent out. Are there any amendments to the agenda? If there are no amendments to the agenda, can we have a motion to adopt the meeting agenda?
I'll move that we adopt the meeting agenda. This is Kim Kuttner.
Thank you. Do we have a second?
Second, this is Pam Teaster.
Thank you. And now, George, do you want a roll call?
Laura Bowser.
Yay.
Giovanni Brown Hughes.
Yay.
Karen Garner with a D.
Yay. Yay.
Chris Desimone.
Yeah, yay.
Karen Garner
Yay.
with a G. Rick Jackson.
Yay.
Kurum Khan stepped away. Kim Kuttner.
Aye. Yay.
Carol Manning.
Here.
Is that an A or a nay?
That was Carol. That was a yes, I am here. Yay.
Okay. Margie Shaver.
Yay.
Crystal Thompson.
Yay.
Pam Teaster,
Yay.
and Ishaan Williams.
Sorry, it looks like I was on mute still. Yay.
Thank you. The ayes have it, and the agenda is adopted.
Great, thank you all. And now we need to review and approve the meeting minutes. And as you recall, we did not do this the last round, so we need to approve both June 9th, 2020 and August 24th, 2020. Has everyone had a chance to read the minutes from those two sessions? And are there any? And are there any corrections? Give it a few more seconds. All right, I'm going to assume that's a no. The minutes are adopted as presented. Okay.
Laura, do you want to do the? Sorry, do you want to do the minutes for August 24th as well?
Oh, yes.
So they're on your screen at the moment.
If there are no changes, then the minutes are adopted as presented. All right, thank you so much. Now on the agenda, we normally move to public comment. No comments were received that I know of. George, I believe that's still correct. And if that's the case, then we can just move directly into the Division for Community Living report with Deputy Commissioner Marcia Dubois.
Well, good morning, everybody. I'll try to shorten this a little bit. It's been some time since you all have received an update. I first wanted to give a bit of a shout out to Kathy Miller and her team and our local area agencies on aging, or AAAs, who worked on a work group to develop and disseminate congregate site reopening best practices as a resource for the AAAs, or area agencies on aging, to utilize. And this has been a really great resource for them, as many of them in local areas are looking to reopen or partially reopen some of their congregate sites, and have really been anxious to have some resources to look at to make sure that they can do so safely. So this team looked at both federal resources, of course, the Department of Health and the CDC, and came up with just a really detailed package that they can all utilize, and it's available on our portal. So Kathy's here on the call, and just wanted to give a shout out to her for the work that team put together. Also wanted to call your attention, for those of you who may not be aware. I know at the last meeting we talked, of course, about the Governor's Conference on Aging being postponed until next year due to COVID-19. And the Conference Planning Committee knew that was quite a long time, and that there were many proposals that had been put forward for the conference when it was to occur in May and then later in October, that we really wanted to keep up the interest and engagement and take advantage of what some of those resources were. And so the conference committee has continued by hosting a series of webinars monthly, and they're held on the fourth Tuesday of each month. And I can ask George to send out the link to you all, but you can sign up for the mailing list. They've been just really great panels, wonderful topics, and you can also access previously recorded webinars. And some of those topics include social isolation and long-term care facilities, social isolation and community-based services, issues revealed for older Virginians by the pandemic, by our own Dr. Teaster. And so really, you can just check out the previously recorded webinars on your own time, but some really great information there so I'd encourage you to check it out. Just want to give you some updates on some grants. Congress did award the Administration for Community Living more funding for the SHIP program, which is the State Health Insurance Assistance Program. In Virginia, you've probably heard of VICAP, or the Virginia Insurance Counseling and Assistance Program, which did receive an additional $115,000. And just in case you're not familiar with what that program is, the local VICAP program can provide you or individuals with free, unbiased, confidential, and personal assistance. You'll get to speak with a trained counselor who can walk you through steps to maximize benefits. And you can get in touch with your VICAP counselor through your local area agency on aging. And just a reminder, Medicare open enrollment period begins October 15th and ends on December 7th. So it's just a wonderful service for people. So I'd encourage you to get the word out and let people know. Also, ACL did award DARS a 1-year no-cost extension for its 2017 Falls Prevention Grant. Due to COVID-19, the Matter of Balance program, which had been utilized previously, is no longer available, but DARS has continued using grant funds. We had grant funds remaining, and we're working with area agencies on aging and other partners to introduce bingo sides to the Commonwealth. So we're really excited about doing this. And we are continuing to spread the Matter of Balance program as well. Another update to the Falls Prevention Program, the virtual second meeting of the newly merged Virginia Arthritis and Falls Prevention Coalition was held in August. And finally, Falls Prevention Week is September 21st through 25th. Other things happening, the Senior Farmers Market Nutrition Program received its third and final allocation. We did get an additional $5,000, which isn't a lot, but it's something, to bring us equal to our 2019 funding. And so this is just a great program that provides fresh fruits and vegetables directly from the farmers' fields to recipients. It's not statewide, but where it does exist, it really is a fantastic program. DARS has approved 201 farmers, 22 new growers, 62 participating farmers markets, and 32 roadside stands. We still do have a respite care voucher program. We continue to operate the Lifespan Respite Voucher program, which provides reimbursement of up to $400 per family caring for individuals in need of respite services. And we're just beginning that last year of that grant. No Wrong Door, our No Wrong Door program, has a number of updates. They did receive some new funding through the CARES Act, and they were able to award some sub-grants to different programs, including area agencies on aging, centers for independent living, and I believe that the sub-grants were ranging in between 15 and 20,000. There were area agencies on aging, centers for independent living, and one other nonprofit organization. In addition, they've partnered with the Virginia Assistive Technology Program, or VATS, to develop and implement a series of assistive technology kits to address independence, personal safety, and social inclusion needs of older adults and individuals with disabilities, emergency social inclusion training. So those kits will be available very soon, and we're very excited about that. They've also worked to ensure that we can make referrals through the system using verbal consent now, which is very, very important during the pandemic. Previously, we'd have to do just for referral now. We'd have to wait until we were able to meet with a person face-to-face to get written consent, which was holding up the ability to get services to people. So very excited about that. Finally, we're really working to get the word out to people to get help remind them about the census. As you're aware, census figures weigh heavily in determining how much the Commonwealth of Virginia receives in Older Americans Act funding. So hope you're out there helping folks remember about the census as well. And then lastly, we do have some exciting news to share. And I know that that George and probably Carter too will be sharing some very big news with you all shortly regarding the BOLD program. So that's it for me, unless anybody has any questions.
Thank you so much. That's wonderful. And now I guess we can move over to the Dementia Services Coordinator report with George, and I'm looking forward to the exciting news.
Thanks, Laura. And let me just pull that up. Okay. So I noticed there were a couple of typos, so apologies. I'll just run through my normal routine. So outreach and education has been lots of webinars, of course, and I'll echo Marcia's shout out for the Governor's Conference on Aging. I'm sorry, I put council, but the Governor's Conference on Aging had these 3 webinars in June, July, and August. And they were fantastic. And if you weren't able to join them live, I really encourage you to view the recordings because they were really excellent. As you can imagine, there has been a lot of programming around social isolation due to the pandemic, which has been really interesting and eye-opening. Lots of issues that are being thrown up that apply particularly to the population that we serve. Another thing that's been kind of a silver lining about the pandemic is the ability to join lots of virtual conferences that I probably wouldn't have been able to attend otherwise. So most importantly, the Alzheimer's Association International Conference. The association did an amazing job with putting on a virtual conference. It was the most sophisticated one I've been part of. And while I wasn't able to see as much as I would have liked, I did get to listen in on a lot of research, much of which went over my head, but certainly there's a lot of exciting work going on in the research front. So that was great to be able to access the Social Isolation Impact Summit and the National Research Summit on Care Service and Supports for Persons with Dementia and Their Caregivers. Those were also really interesting programs. And then one that I didn't know very much about was the Florida's Project Vital, which was had a half-day conference in August, which was really interesting. It was they partnered with the Alzheimer's Association and other groups, the state, to get tablets and other technology to people in long-term care facilities in order to try and minimize social isolation. It was a really excellent project, and some of that we will be hopefully reproducing here in Virginia through the Project ECHO. My colleague Nick Slentz and I presented on programs and services that DARS provides mainly to veterans at the Central Virginia Veterans Administration Health System first annual Caregiver Summit, which was in August. And that brought together people from various agencies serving veterans, as well as some community programs as well. Lastly, I had the honor to present on Virginia's dementia capability and state plan at Idaho's Dementia Capability Summit. That was last week, 2 weeks ago. They haven't updated their state plan since 2011 and are working on re-energizing that. And so it was really a great opportunity for us to share some of the great work being done in Virginia. And they're very excited about moving forward with providing better supports and services for folks living with dementia and their caregivers. I've done a couple of Dementia Friends Champions training virtually. I'll be doing a dementia awareness class for the Virginia State Police recruits to tomorrow, actually in person, which will be interesting. It'll be the most people I've seen in one room since the pandemic started, but it's going to be held in a gym, so everything will be safe. There's a few other future things that have been not yet scheduled, but one thing that I will be part of is a panel on faith, family, and dementia at the Alzheimer's Association's Memory Care University in October, which I'm looking forward to. I'll be doing that with Veronica Cosby from the Virginia Health Department's P3 program and someone else who I forgot. So if it's somebody on the call, I do apologize. But that should be interesting and a good opportunity to talk about how we're trying to get brain health and dementia messaging into faith communities across the Commonwealth. For data, the big thing is the BURFOS data has been released for 2019, but only the raw data so far. So I'm waiting for the health department analysts to give us the summaries of the caregiving and cognitive decline modules. Hopefully that should be coming in the next several weeks. So that'll be really useful in terms of informing our policy platform over the next few years. Collaborations, partnerships, so quite a bit still going on. And I'm not going to go through all of these, but even though everything's moved virtually, most programming so the dementia-friendly initiatives have kind of been stalled to some degree by the pandemic, although there's still some communities that are doing the preliminary work. Williamsburg just applied to join the national network and has been accepted, so that's great. So still work is going on. I was talking to some folks in Chesapeake and Hampton Roads about kickstarting an initiative there as well. So the big news that Marcia alluded to comes under grant writing and administration. So Virginia was awarded one of the BOLD Act grants for public health programs. Virginia was one of 5 states to receive an enhanced grant, which means that we have a state plan and some of the dementia capability network or support structure in place already. So that news just came this morning. That is a 3-year grant. Virginia Department of Health is the lead awardee, and DARS, the Alzheimer's Association, and several other partners are key partners in that. So we have a number of programs that we put forward to fund through that grant. Some of the things the commission itself is working on, like the adaptation of the Washington State Dementia Roadmap. We will have some funding to print hard copies of that to share with folks across the Commonwealth once that's finished next year. And support for lots of smaller initiatives. So very excited about that. The other grant that I'm still working on is the Virginia Center on Aging GTE grant that we received last year. We received just under $25,000 to bring the Dealing with Dementia caregiver workshops from the Rosalind Carter Institute to more areas of the Commonwealth. Previously, there were trainers available in Richmond and Williamsburg areas, and also Newport News. With that funding, we were able to train 20 folks. They were all trained in January. As I mentioned before, I think one person is still due to receive the training. She was unable to do it in January, but she's scheduled to do it in September. And we've now embedded that program in every planning district west of the Blue Ridge Mountains, Northern Virginia, and also many of the planning districts just on the eastern slopes of the Blue Ridge. So pretty much the whole western half of the state, which is super exciting. We'll also be able to provide that workshop for free to over 780 caregivers. So those, while that program was not available virtually, Rosalind Carter recently released a virtual option, so that's great. Some of the agencies have moved forward with in-person workshops, observing appropriate social distancing and protections, but many had decided not to move forward yet with in-person programming. So now having the virtual option is really great for them. And we did receive a 6-month no-cost extension through the end of the year to enable us to be able to report on as many workshops as possible. And I don't believe there's any new legislation, legislative initiatives on the tracking policy section. If there are, Carter, you can talk about those. And that's it for me. Are there any questions?
No, but that's really awesome news to get this morning. Thank you. So I guess with that, we'll move into our work group and committee reports. I guess the one upside to COVID has also been the fact that we can meet electronically. So our work groups have not been quite as a headache to schedule as they were in the past. And I had the pleasure of sitting through all the different work groups and getting to learn a little bit about the work that some of the groups are doing that I wasn't a part of previously. I know it's listed that we're going to have the legislative committee speak first, but George and I were talking about possibly moving that to the end since it kind of dovetails into what we'll be working on next session. So with that, maybe we'll turn it over to Rick, if you want to give us an update on the training work group.
Yes, thank you. Everyone can hear me? Yes. So we met July 29, and I want to thank all the members of the work group, to include Karen Garner, Ishaan Williams, Kim Kuttner, Laura Bowser. We added Denise Butler and Vicki Armstrong to the group, and it was a lively, interesting discussion. And we talked about the very important issues of training everyone across the state in regards to these things. We began the discussion by talking about 3 protocols branded by Dementia Friendly America, originally created for the Act on Alzheimer's in Minnesota. And those 3 protocols and tools are the Community Organization Practice Tool, and you can see this in your notes, the Clinical Provider Practice Tool, and After a Diagnosis. So what won't surprise you is the discussion that was centered around primary care and how much they are in need of these protocols and tools and information. But honestly, how their time is so limited and restricted, and their time is so difficult to get. It always has been, but with COVID, it's even more difficult now. So we certainly spent a lot of time talking about the challenges and the barriers to providing this kind of education in primary care. So where the discussion went was that members felt that there ought to be a broad campaign to use these package of tools and to create an awareness campaign and use micro-learning. And I don't know how many of you are familiar with micro-learning, but Mary Martha Stewart from the center has spent a lot of time funded by some grants and others to develop micro-learning for all kinds of populations. But one of those populations that micro-learning was developed for was indeed primary care. And it's a wonderful package of tools, and it's very brief, and it can be digested, obviously, in micro sessions, and it's available to primary care or any audience that we would want to train 24/7 whenever they want it, as opposed to suggesting to them that you can only get it from 1 to 2 on Tuesday. So what we've discussed and what we're suggesting to you today is that we use an awareness campaign, social media campaign, training and advocacy, and to the extent possible, use micro-learning modules to get this word and this important training out to primary care and to other populations. So Kim, anybody else who was on the task force, if you'd like to add to that, feel free.
Thank you. That described it well, Rick.
Well, thank you. George, any follow-up or thoughts?
No, Rick, I think that sounds good. We'll be meeting again. We'll aim to meet again in late September, early October, and see what we can include under the BOLD grant, because I know we had talked about kind of leveraging our efforts with broader public health messaging for brain health and dementia, and of course that's what the BOLD Act is funding. So hopefully we'll be able to include some of this.
So does this require a vote of the commission to accept this, Laura, or no? No? Okay.
Thank you so much.
Yes.
And so we will move on now to the coordinated care work group report. George, do you have? There we go. And I will turn it over to Kurum.
Hey, thanks everybody. So we met on July 29th, and as Laura said also, right, it's much easier to meet now because we are so geographically spread abroad, but this helped us a lot. Our focus has been to adapt the Washington State Roadmap for Dementia and that I'd adapted for Virginia. The BOLD Act health program, we include funding for 5,000 copies of the finished product and a 12-month work plan. And with the news that, yes, we have got the, the BOLD Act, so we believe that this is going to be a reality now. We discussed several sections of the roadmap, which was, which we took from the Washington State. The services, George will work with, the Alzheimer's Association and agencies on aging to solicit caregiver spotlights, because what we are doing is they have it's like the roadmap will have certain comments and quotations from the caregivers, comments with respect to specific stages of dementia. We want to use photographs of real people rather than stock photos. So that's one of the discussions. We said that if we can make it real, we can make it more relatable to our to Virginians. That would be great. The the DSC is exploring holding photo competition for the cover page with member suggestion, iconic but culture-free Virginia subjects, right? So this is for the cover page, because the cover page was just like, we can just show a pathway or Shenandoah or something like that, but we thought that if we can do a photo competition, it would be better. We suggested a number of additional content areas and information to include, such as specific questions or instruction around doctor's visit to discuss cognition. Obviously, this is a working map, and our group will continue to do this. Prior to publication, the draft will be made available to review, including family and professional caregivers, healthcare professional commission members for input. We plan to meet again electronically in September, early October. I believe the date's been set, but I'll leave it up to George for that. But that's all. If there's any questions I can take, I'll be happy to do that.
Great.
Right.
If there are no questions, we'll move over to the data and research work group. And I know Lana is out, so George has volunteered to give a recap.
Yep, thanks. So the data and research work group met on August 10th. We had a very broad topic area that we were attempting to narrow down. So the broad goal was to explore proposed support initiatives to improve the understanding of the needs of people in underserved populations or communities. We had a very wide-ranging discussion about ways to better understand these folks' needs and to increase their involvement in research, particularly. And that's certainly one of the goals under the state plan. And we also talked about, our members also talked about looking at ways for researchers around the state to become more aware of their colleagues' projects, so not just the RDRAF projects, but the Alzheimer's Research Fund, but also projects that are being funded by NIA or other bodies, and to increase opportunities to share that data and outcomes. So we of course talked about All's Possible as a venue for that. Currently, we do put all the RDRAF award information and project information up there, but it would be nice to have a broader forum for researchers to see what their colleagues are doing and to be able to share data and outcomes as well. So the members came up with a really fantastic idea, I thought, Dementia Research Forum, which could happen once or twice a year. And this would be maybe a hybrid in-person, virtual, maybe more virtual than in-person to begin with. We were thinking that folks who are doing research could provide brief presentations on their ongoing projects or the results of a previous project. So we call them flash presentations that would be about 5 minutes long. That could be recorded so people could view them at any time. But we'd also like to see folks with lived experience, so folks with a diagnosis or caregivers, participate in this forum as well to help maybe guide the direction of research and to promote the involvement of more people in research. So the forum itself would need, so we haven't really fleshed this idea out too much yet, but we'd like to see the forum having some specific goals that would help maybe secure funding, such as maybe achieving Goal 5B of the Dementia State Plan, which is about involving underserved populations in research and similar efforts. So we do see All's Possible as a valuable tool for the forum, but we need to do outreach about the website as well. Members remain concerned that not many people know enough about All's Possible, particularly in the research world. And we finished the discussion with a conversation about the need for better statewide data collection. And this is something that members wanted to bring to the full commission to discuss. And I'm not sure if we have time on the agenda for that today, but maybe this is something that we can add to the agenda for December, if that works for you, Laura. But you know, some of the ways that other states try and get really excellent statewide data is through statewide registries. These tend to be voluntary and little used, so while they sound great on paper, they may not actually be achieving much in terms of that higher quality and more comprehensive data that we're looking for. So we would love to hear everyone's ideas, but I think we'll add that to the agenda for December.
Yeah, I think that's great. I think we need a good, 20-30 minute section for that.
Yeah, and the BURFOS data should be available by then as well, so that might guide our discussion a little bit.
Perfect. Well, thank you, George. And yeah, I'm excited to have that conversation with everyone come December. And then last but not least, I will turn it back to Rick to give us the legislative committee update.
Yes, ma'am. Thank you. So George, you're going to put up the slide there. So first of all, I want to thank everybody on the task force. A lot of work went into this. Offline meetings, a couple of meetings online, And I really want to thank Carter Harrison and all the people at the Alzheimer's Commission that he works with, and George, because so much of the language that you're going to see today came from them. And what the task force really did was discuss it and edit it and make improvements upon it. But really the majority of the legwork came from Carter and George and those folks. The other thing, George, and I'll defer to you on this, is that the intention of today was to present this to you, have you look at it, read it, ask questions, and potentially take a vote on it about approving it. But I guess based on the good news this morning, we may have to edit it further. Would you agree with that, George? Instead of voting as is, we're going to have to edit it.
So Rick, I think there's going to be very minor changes to the final platform item that that you or I could walk folks through. But really, it's do you want to talk about the platform items first, and then when you get to the last one, we can talk through those changes, because the other two don't change.
Yes. So Carter, you're still on, right?
I'm here.
Yeah. So Carter, as most of you know, anything that anyone's talking about these days has been so drastically affected by COVID. So you won't be surprised to see that item number 1 is primarily focused on COVID and what happens in long-term care with testing and treatment and information and surge protection. And so most of that language is about COVID and the effect it's had on long-term care facility. But I do want to point out that one of the task members also took great length to talk about how COVID is affecting the community at large and those older adults and caregivers who in fact are still in the community and not in facilities. But Carter, would you like to speak more detail about item number 1?
Sure. I think what we've tried to do in item number 1 is distill a large number of recommendations into a small number of items that basically concentrate on what's going on in assisted living and nursing facilities. So we want to make sure that we have, from a state policy perspective, the support that's necessary to keep folks safe in these environments. And so you'll see the highlighted items are sort of the 4 big points that I would like you to concentrate on. The first is the testing and ensuring that we have testing for the residents and staff. And I don't know if you all have noticed, but there's a piece of legislation making its way through the General Assembly now, sponsored by Senator Chafin, about prioritizing testing for long-term care facilities. And just a reminder, that's where the majority of deaths in Virginia have occurred, or in long-term care facilities. And of course, then, having that information reported accurately, you recall that Governor Northam initially was not reporting that data based on facilities, and has since changed that, and is now doing so by facilities. And in fact, there's a bill by Delegate Sickles and a companion bill in the Senate, the patron escapes me right now, but that allows that information to be reported in these circumstances, so that even if the governor's order expires, then that information can be reported going forward. And then sort of the second item deals with surge activation. So when we have a problem in a facility, to make sure that we get the resources to that facility as soon as possible, in whatever form that may be taking, PPE, things of that nature. And then lastly, that deals with supporting those facilities. And I already sort of referenced the PPE and equipment that they might need, but also training and help with their staff. And then lastly, I said 4 items, but we actually added a 5th, and that deals with the vaccine and ensuring that there's priority for facilities and long-term care facilities when the vaccine becomes available. So hopefully that comes available soon. And Rick, that's sort of how I'd sum it up.
Yes, thank you. Much discussion, hard work went into that. Are there questions from the group about item number 1? Hearing none, I'm going to go to item number 2. As you know, one of the high priorities of the commission and DARS for a very long time has been this issue of the funding of interdisciplinary memory care clinics and care management throughout the state. We all painfully are both personally and professionally aware of how important they are and how rare they are, and how it's so difficult in primary care and other areas where clients are seen to get accurate diagnoses of dementia and to get really wonderful referrals to the care they so desperately need. So item 2, as you can imagine, continues to focus on history, importance. There's some discussion about what's going on at UVA and also at SEAL, and highlighting the point that we have to continue to look at this and continue to look for funding for this. Carter, you want to add to that?
Yes. So for those of you that may be aware, in the last General Assembly, we received $150,000 annually to sort of kick off this case management program from a state general fund perspective. And we were sort of viewing that as a pilot during the freezing that occurred for the pandemic. Those funds were frozen along with all the other new sources of funding. That's currently being discussed by the General Assembly now, and there is a very, very small chance that we could get that funding restored, but I'm not going to count on that. So I'm planning to make the full ask for the $300,000, which would be a larger pilot than we had, which is what we asked for to start of last General Assembly for these funds. And it's primarily a partnership with the Memory Disorders Clinic at UVA and the Alzheimer Association. And George, I don't know if we used to have the Alzheimer Association mentioned in that link or not, but either way, that's what that is. And with the goal of growing it across the state once we get the first one funded.
Carter, thank you. George and Carter and the rest of the members of the commission, I did reach out to my colleagues at Riverside and gave them access to this report. And this morning they gave me their comments. And I've sent them to both Carter and George. And so you'll have them as we move forward in promoting this. They were very supportive of everything in here, Carter and George, and you won't be surprised to know that the individuals at SEAL and Riverside did speak about how important it is to have pharmaceutical medication review at these clinics. That was added to SEAL's ACL grant as they developed their care management, and the research has been really very clear about the importance of having a pharmaceutical-led medication review at these clinics. I don't know that they're suggesting that it be added to the language, but they certainly want to point that out about how important that is. Any comment?
Rick, just from my perspective, I think the medication review is a potential item that we should explore further because of its positive impact. And I've talked to Christy about this, what I haven't, from my perspective, figured out is how to shape the policy to move that forward quite yet. So I think that's a issue that will be ripe for a future platform item. But I think right now we're just not quite ready to move forward from a policy perspective on it yet.
Yes, and I would agree, and you and I discussed this offline. And so my point today really was just to raise the progress that's been made in that regard so that we can consider it in the future. And then last but not least, go ahead, yes.
I had a question, Rick, just in terms of medication review, who would be doing the medication review?
So at the center, we brought in pharmacists who were both on-site and telehealth, reviewed medications of every client who came through our geriatric assessment clinic and our memory assessment clinic down in Newport News to look at all the things, Carol, that you're so painfully aware of, where there's been duplication or contraindicated or simply a simplification, if you will. And so they make recommendations on those medication regimens and they pass them on to primary care, they pass them on to neurology, they pass them on to geriatricians. And we've just seen marked improvements in all the things that you would expect.
So we always do medication review. That's a standard part of what we do. But so you're saying bring in pharmacists outside of the practitioners?
Yes, historically our team was a geriatrician, a nurse, a social worker, potentially a neuropsychologist. But in the ACL grant that we received a couple of years ago, we decided to add pharmacy. And it was welcomed by everyone. And so Christy can give Carol, you and Carter and George, the research, not anecdotal, yeah.
We actually have a PharmD on our team who, so every patient has we have a PharmD who works with us, but it's our physicians, one of our geriatricians, his big theme is deprescribing because people are on so much, but you're talking about adding an additional person a pharmacist who then reviews the records of every patient?
Well, you should see them as a consultant to the geriatrician, not acting unilaterally. Yeah, so they're part of the team. And there is criteria, by the way, about who gets reviewed. And Kim, you're on the line. You might be able to speak in some more detail about what the criteria is about who gets reviewed. It has something to do with the number of medications and other comorbidities in their preliminary diagnosis. Is that right, Kim?
Correct. And we can share more with Carol offline as well.
Yep. Thanks.
We simply want to, what we believe is a significant improvement in services delivered to those patients and family members based on adding that. The only other yeah, go ahead. Yes.
We have a pharmacist who's with us, as I said, but I guess what I'm questioning is isn't that the job of shouldn't medication review occur with every patient every time they are seen?
Yes, absolutely. All and by the way, the geriatricians concurred with us. All that we're saying is that the pharmacists bring much to the table story have had, and they've welcomed the addition of that team member.
Yeah, and as I said, we have a PharmD who is in clinic with us, and she is fantastic.
So you hear where I'm going?
I do hear where you're going. I'm just wondering about we add, how, in general, is this going to be experienced as one more team member that has to be added and feels like a high bar to jump, but there
are challenges, Carol, not the least of which is billing. So the pharmacists do bill,
right?
The people in administration would suggest to us that what comes through the pipe in revenue doesn't really cover their cost. Right. So right now the grant subsidizes that. Yeah. So the question becomes, and Carter and I have discussed this at length, and I think which is why he wants more research and why you're raising these questions. The question becomes, down the road, absent federal funding, where are those costs covered in a revenue perspective? And I think that's what we have to spend more time looking at.
Carol, Rick, I think there's a lot of questions is sort of why we still have to keep this thing stewing for a little while. So at any rate, I don't mean to sort of shorten the conversation, but.
Sorry, I didn't mean to derail. I'm just curious about it. So happy to, Rick, we could just, and Carter, maybe discuss this offline another time.
Yes. Yeah. And Christy and the folks at SEAL will be happy to be involved in that discussion, Kim as well. So thank you.
Great.
So last but not least, guys, is the third item that we were talking about through Carter and through our task force was to continue to advocate for BOLD, as we've done for many years now. So obviously the good news this morning affects this. So go ahead, Carter.
Sure. So since we have the BOLD grant funding, originally we had asked for funding just in case we didn't get it. But I think now the last line is probably the area that we want to change, and that's basically to strike the funding to support and support it, replace it with support. And the reason for that is the commission actually has a fairly large role. Maybe that's not the best way to describe it, but has a role in the BOLD grant proposal process. For example, we had to have a commission, we had to have a state plan. These were all prerequisites for getting this funding in the first place. And so I think we need to make sure that we assert sort of a technical role in how these things get moving forward and how we use it to address some of the state plan items that we have that we want to move forward on, that George has referenced some of that are in this grant. And so I think it's important that the health department see the commission as having some role in fulfilling this and not just George in doing that, because I think otherwise you might lose sort of the outside the state perspective for some of these issues. So that's sort of what I would like to refocus this item on by making that slight change. And, just for infrastructure purposes, George has, I think, a very important role to play in this with the health department. And I just don't want the commission's role to be diminished, because while George will do a great job, it's hard for him to represent all these groups. So hopefully maybe there's a way to even get the chair of the commission involved more directly on some steering committee or something of that nature. And that's what I ultimately would like to do to move this item forward.
Thank you, Carter. So George, let me ask this question. Would it be appropriate now to entertain a motion to support this legislative platform with the editing just done to item 3?
We can, or we can just have that as included in the annual report, because this is being dropped straight into the annual report, and that's the next agenda item.
Do you have a preference of how you'd like to do that?
Laura?
I mean, to save time, I think we can just drop it into the annual report as long as everyone's okay with that.
So any other questions on the 3 items, and then we'll move forward? Hearing none, it's back to you.
Thank you.
Ma'am.
And Carter, I'd be happy to discuss supporting the help on that 3rd item. Let me move this over here. With that, we're going to move directly into the annual report. So as you know, every year the commission is required to report on its activities on policy recommendations to the governor and the General Assembly in DARS by October 1st. The draft was sent out last week to everyone. I know it's a short turnaround, but that's unfortunately due to the timing of the General Assembly's special session. We're gonna go ahead and pull it up. And I just want to see, has everyone been able to have time to review this? And is there any feedback? Likewise, any recommendations for amendments? And as George mentioned, we will drop that language directly into this report. Hearing no amendments. Oh, go ahead.
I was just going to say this. So the only changes stemming from that discussion would be around this heading on the last item. So we'll have maintain and support the public health approach to Alzheimer's disease and dementia. And then the last sentence in that item would be the commission recommends supporting this public health approach to address the needs. So excising the funding language.
And George, do we need a motion to incorporate those amendments? Or just to approve?
Probably. Well, we could. Yes, we should probably have a motion to incorporate those amendments.
Okay. Does anyone want to make the motion to incorporate the amendments?
This is Rick, so moved.
Do I have a second?
Second, Karen Garner.
Thank you. All in favor, George, on a roll call?
Yep. Laura Bowser,
Aye.
Trevania Brown Hughes,
Aye.
thank you. Karen Darner,
Aye.
Chris Desimone,
Aye.
Rick Jackson,
Aye.
Kurum Khan,
Yes.
Kim Cutner,
Aye.
Carol Manning,
Aye.
Margie Shaver,
Aye.
Crystal Thompson,
Aye.
Pam Teaster,
Aye.
Ishaan Williams.
Aye.
That's carried. Laura, would you like to ask for a motion for approving the full annual report?
Yes. Do I have a motion?
I so move, Karen Darner.
Thank you. Do I have a second?
Ishaan, a second.
Thank you. All in favor? One more roll call.
Yep. Laura Bowser,
Aye.
Trevania Brown Hughes,
Aye.
Karen Darner,
Aye.
Chris Desimone,
Aye.
Rick Jackson,
Aye.
Kurum Khan,
Yes.
Kim Cutner,
Aye.
Carol Manning,
Aye.
Margie Shaver, Crystal Thompson,
Aye.
Pam Teaster,
Aye.
Ishaan Williams.
Aye. Aye. I'm having some technical difficulties. Sorry, I was a little delayed.
That's fine. It's a unanimous vote to approve the annual report.
Thank you. Report is approved. Moving on to, I guess, next action item is, well, first, our next actual meeting will be held December 8th. So please make sure that's on your calendar. And then George has gone ahead and placed next year's calendar in front of us, proposed calendar. And so the proposed dates are March 9th, June 8th, September 14th, and December 14th. Again, these are Tuesdays. We have no idea whether it's going to be in person or digital, virtual, hopefully in person, but probably not at the beginning of the year. Any feedback and or changes to this calendar? And if there's no feedback and changes, we will need a motion to adopt this calendar. Do I have a motion?
Yes.
Rick.
Yep. I'll second. How's that?
There you go.
Yeah.
Thank you. All in favor? Roll call.
Laura Bowser,
Aye.
Trevania Brown Hughes,
Aye.
Karen Darner,
Aye.
Chris Desimone,
Aye.
Rick Jackson,
Aye.
Kurum Khan,
Yes. Aye.
Kim Cutner,
Aye.
Carol Manning,
Aye.
Margie Shaver,
Aye.
Crystal Thompson,
Aye.
Pam Teaster,
Aye.
Ishaan Williams,
Aye.
thank you.
Did you hear me? Okay.
Yes, I did. Thank you. So that's a unanimous vote in support of the adoption of the calendar for next year.
Perfect. Thank you all. And finally, I would want to open the floor to any new business. Is there anything that anyone wants to bring to the floor?
Laura, I just want to congratulate the commission. As y'all will recall, for the bold piece, you supported a bill that sort of set that process up to make it a little bit easier for the collaboration between the health department. There's been 2 bills actually. So I appreciate the work of the commission to help accommodate those things, and also want to thank the commissioner for DARS for agreeing to work with the health department to ensure that we had a strong, bold application. And I think that George's work, the commissioner's support, and the work of the health department have all sort of come together to make that happen. And I want them to know how much I personally appreciate that, and how I'm looking forward to seeing the results of that.
Thank you. Yes, and likewise, I'm just very excited about everything. Any other comments? New business? This is always awkward done virtually. With that, George, thank you everyone for your reports, for joining today. And with that, I will announce the meeting is adjourned.
Take care.
Thanks.
Thank you.
Thank you very much.
Thanks, everyone. Bye.
Thank you.